Tuberculosis remains one of the leading infectious killers in South Africa. On World TB Day 2025, we reflect not only on progress made, but also on the failures still costing lives, particularly in overcrowded townships, informal settlements and prisons. This year's theme, Yes We Can End TB, calls for tangible commitment and investment. But will political rhetoric finally translate into action? South African Medical Association Chairperson Dr. Mvuyisi Mzukwa is my guest on this conversation. Dr. Mzukwa, always good to speak to you. Now, how do we justify still having the highest TB death rates globally, despite having decades of research and policy on paper? It's almost intangible.
Good afternoon to you, Hugo, and your viewers, and thanks for having me. Yes, you are quite right. We are almost leading in terms of research in the country. And we, like you said, we've got so many people who are dying, from TB, about 56,000 people a year, and a burden of about 468 people per 100,000 in the country. Though we have seen some decrease in terms of your incidents, that is new entrants, to this population of people having TB, but we're still far, from achieving our goals. But the important thing, Hugo, is not only the research. It must be it must go together with other issues. You must address the issue of poverty. Because it's a main driver, poverty, unemployment, but also other condition risk factors like your HIV, diabetes, conditions like those. They contribute quite a lot to what we call socio-economic determinants of health. Now,
one would imagine that as doctors or medical professionals, you've done your bit. Now, the theme is commit, invest, and deliver. Has a government delivered at all on this? Was this another ceremonial slogan?
Well, I think to a certain extent, government has done something in terms of taking down the new entrants into the population. But like I said, it's still high up there, around 427 per 100,000 who are still contracting TB. So you can imagine that we are still far from getting to the end of this epidemic. But I think it's encouraging that government is coming up with these proposals and these plans, to make sure that we get to that level. I mean, if you look, for example, the End TB campaign that was started by the World Health Organization a long time in 2015, and set out, targets, for us to follow. But I think in South Africa now, the other challenge, which I think it's really gonna leave a dent in terms of how we respond, is the funding. We know that we've just had funding withdrawn by the USAID. So I think it has some will have some disruptions in terms of the follow-up. Hugo, that the greatest problem is those that are asymptomatic. In other words, people that have TB but don't have symptoms or typical symptoms of TB. And also the problem is the male population, where you find that they are hesitant to go to the healthcare facilities to be investigated, even when they are symptomatic.
So let's talk about the implications of this loss of funding from the United States. I mean, from what we understand, those numbers run into billions of rand. What implication is it going to have on the current numbers that we're dealing with? I mean, you talk about 428, 427 per 100,000. Are these numbers likely to rise?
If our government is not coming in terms of filling in the gap, it is going to rise. The numbers are going to rise. And the other problem is that, with this funding, it has been helping us to trace cases that are in the communities, where you find that people may be hesitant, to finish even the course, because it's quite a long course of about at times 12 months on TB treatment, especially if you've got the resistant strains. So you need that psychological support, not only that, but also making sure that you give also financial support, because they need transport, they need meals, and all these things. So if you lose that portion, you are then unable to follow up, properly, unless our government would come in and say, we are going to continue, to monitor and also look out for those patients that are already taking medication. Otherwise, we're going to lose the battle. It's going to spread. It's going to take us to resistant strains of TB if it's not managed properly.
So astonishingly, we do incredible research around tuberculosis and related illnesses. The numbers are still pretty high, as you agree, at 428 per 100,000. So what are the successes that we've enjoyed and as far as combating TB is concerned?
I think one of the successes was our HIV program. Our HIV program has assisted us, in terms of taking down that the new entrance into the TB space. But now what we have seen, Hugo, is people who are HIV negative, who are now presenting with symptoms of TB. Now, because there's been this stigma that if you've got TB, it automatically means that you are HIV positive, which I think that's a messaging that we need to change. You can have TB without HIV. So if you have got TB, you need to be assessed earlier. You need to present yourself earlier. I mean, sometimes you find that you have flu symptoms. You go to the pharmacy, get some medication and all these things, or you get to your doctor. But once it goes beyond 7 days and it's getting worse, you need really to make sure that you get medical attention. You need now to be investigated for TB, even for minor things that you think, no, it's just the flu symptoms and stuff like that. But if they don't go away on conventional medication, then it's time for you to see your doctor and being investigated for TB.
Dr. Mvuyisi Mzukwa, Chair, South African Medical Association, speaking to us on those numbers around tuberculosis in South Africa and certainly the successes that have been made over the years.